Cleaning and disinfection are important in the prevention of healthcare-acquired infections and keeping patients and staff safe. Why? Let's start at the beginning. Microorganisms survive on environmental surfaces like patient equipment, the patient's bed and furniture, sinks, basins, and commodes. These microorganisms can survive on environmental surfaces for a long time. Influenza can live for several days, VRE can live for up to 4 months, C. diff for 5 months, and Staph aureus, including MRSA, can live up to 7 months. One way to stop transmission or spreading of these microorganisms is by eliminating the means of transmission by properly cleaning and disinfecting. We can break the chain of transmission. Who can help? You. Today we are going to focus on reusable patient care equipment. Patient care equipment that is reusable must be cleaned and disinfected between uses. This includes items like glucometers, bladder scanners, and stethoscopes. How do we know what to do? The Spalding classification scale divides equipment by its use. Objects that come into contact with intact skin, but not mucous membranes, are classified as non-critical and require low-level disinfection. This group includes items like glucometers, bladder scanners, and stethoscopes. Low-level disinfection is cleaning the equipment with the appropriate disinfectant. Remember to wear appropriate personal protective equipment when disinfecting. What disinfectants do I use? We use the gray AF3 wipes and the orange top bleach wipes. The use of the disinfectant must follow the manufacturer's instructions to effectively kill the microorganisms on the equipment. The item must remain wet for a specific amount of time called a wet time. This means the item must remain wet for the full wet time, but it does not have to be continuously wiped. It is appropriate to wipe the device and let it sit as long as the entire surface remains wet. Where do I find this information? Look on the product container's label. Equipment, like a glucometer, is cleaned with the orange top PDI bleach wipes and require a 4-minute wet time. When the gray top AF3 wipes are used to disinfect other items, a 3-minute wet time is required. Remember, the patient room is always considered a dirty zone, and the hallways are considered a clean zone. Always wipe items at the point of use and transport clean. PPE should not be worn in the hallway to transport items that have been low-level disinfected.